Hey you guys, welcome back to my channel. If you're a new subscriber, hello, welcome. Check out my other videos. And if you are a returning subscriber, as always, thank you guys so much for sticking with me through my inconsistency and my ghosting phase with YouTube. Can I even call myself a YouTuber for real? Because like once a month is kind of crazy. I really am going to try and get back on track doing like once a month. I mean once a week. Once a week is what I said. Keyword being try. Keep that in mind. Keyword being try. I will try. Okay. I have a bunch of exciting things I want to film and put out on my YouTube channel that is not related to nursing. So I am so looking forward to all that. And that's really going to be my motivation for uploading each week. I don't know why I keep saying once a month. Each week. Okay? Each week. So. So, the last time we talked, we were talking about how I was all over the place with my nursing career that only just started maybe, what, like 10 seconds ago maybe. But I am still in home health. I'm still working with pediatric clients. Also, I may say clients and patients. It's just like interchangeable depending on the setting. Home health, you say clients, but I have been working in a nursing home where we refer to the residents as patients, but it's just like interchangeable. So, I am still a home health pediatric nurse. Now, because I can ramble, I have to stay on track. So there are many reasons why I decided to leave the facility setting, just because of the scheduling, the bi-weekly pay, and just all the little hoops you have to go through to get time off, and you have to call out, find your own coverage, those type of things. But we'll get into that a little bit later. What is home health? Home health is just where you're a nurse or a CNA or any type of medical professional coming into the home giving care. That's all it is. Now, I specialize with G-tubes, trachs, vents, kind of, sort of. Vents are not hard to deal with. Yes, I am intimidated by it. Yes, I got trained on how to work one. I'm just not going to touch it. I do not feel confident in me working a vent, okay? So, yes, with kids. So trachs, vents, G-tubes with kids. Depending on which route you take, some home health companies, they will have like a 1 day of like educational training with like 24 to 36 hours of like in the field training with another nurse. Some companies will have a residency program. When I first graduated nursing school, I was in a residency program with home health, with trachs, G-tubes, and vents, called BAYADA. Love that company. I did not realize that company was as big as it is. I'm going to link their information down below in my description. They had a residency program, and it was a great residency program. The reason that I left, well, let me tell you about the residency program first. So the program lasted a year. Okay, you came in the program making X amount of dollars. I want to say after 3 months you bumped up to another amount, and then after 6 months you bumped up to another amount, and you maintained that amount throughout the rest of your residency program. I was not happy with those numbers, so it's kind of like I'm gonna head out now. But overall, love the experience. So for example, a week in the residency program would be like Monday you had what's it called, like Zoom or a team meeting, where it would be like from 8 to 12 and then from 1 to 4, where you would go over with your clinical instructor, not clinical instructor, with your clinical care coordinator, educator, whatever you want to call it, and you had that hour break from 12 to 1. And then maybe Tuesday and Wednesday you had sim lab, where you go into the office and you had like a respiratory therapist train you on like the different trachs, G-tubes, vents, and things like that. And it's just sim lab. Like you have a mannequin who was like responsive and things like that. They give you different scenarios. Things like that will be on like Tuesday and Wednesday. And then Thursday and Friday you had like homework. Or you have homework on Thursday, and then Friday you had an orientation shift where you would go out and train with another nurse. It was something like that. And if you wanted to specialize with children, which is something, it's not completely different, but the sizes and the way you go about things is a bit different because they're smaller. You know, it makes sense. So I stayed there for about 3 months, and then I moved around, and then I ended up here at the home health company that I'm with today. So The home health company that I'm with today, they offered like 1 day of educational training about the G-tubes, the vents, the different type of pumps, and trach care and things like that. And then I had 24, was it 36? I don't know if it was 24 or 36 hours. But long story short, I would just go out and train and orientate with another nurse, do like a meet and greet with the family, who I would be a full-time nurse for and things like that. And then once I got comfortable enough, I don't need orientation anymore. I'm like, okay, cool. I'm out on my own. And a good thing about home health is being that you provide all the care in the home. Like anything you need is already in the home. Oxygen tanks, concentrators, humidifiers, tubing, O2 tubing, the extenders for your Mickey or Minnie, pumps, Kangaroo, Infinity, 2x2 gauze, the normal saline bullets, the pulse oximeter tape that you tie around their like toe with your finger. Anything you need for that patient is going to be in the home, supplied by the company. So there's never a time that I'm in the home like, damn, I'm like, dang, I don't have syringes or anything like that. The company is going to supply it to you. But it is your job to communicate if you're low on gloves, if you're low on napkins, if you're low on anything that you would use on a daily or weekly. It is your job to let the family know and also let your clinical coordinator know. Yeah, clinical coordinator know. Also, there are 2 different types of home health that you can do that I know of. If I'm wrong or incorrect in any type of way, please educate me in the comments below. You can have like one patient, like I have one patient that I take care of Monday through Friday, and it's 8 to 5 every day. I only see one person. Or you can have like 2 or 3 clients that you see on Monday, and then you have one client that you see on Tuesday, and then on Wednesday you have 4 clients. You can just go check up on them, do morning care here, do an assessment here, go over there a little bit. Okay, they're good, we're gonna chill over here for a little bit too. I'm not doing all that. Like there are some companies where you can do that, but I'm not. Do you know how much gas is these days? And I don't know if they like reimburse you for gas or if they just give you like, okay, go see these clients from 9 to 5. You're gonna get paid regardless of how long you're gonna be there. But I don't know that much yet. But all I'm saying is gas is too much to be just driving around the city. Okay, and I have a Honda, so that says a lot. Those are different types of home health companies that I know of. I just have one client. It's a 1-to-1 ratio. Some of the pros to working with home health or just agency in period in general, the weekly pay. Like weekly pay is what got me. Okay, I cannot do bi-weekly pay. I just can't. I know that sounds crazy, but I just can't do it. I cannot. I don't think I'm ever gonna go back to being paid bi-weekly. Even when I first graduated, I did the residency program, weekly pay, and then I moved to the long-term care. That was weekly pay. I think the company's like Sabre Health, they do weekly pay. And I'm here with another home health company, weekly pay. I just don't see myself going back to bi-weekly or monthly because I done started a lifestyle that I can't support if I'm only getting paid twice a month. It's just not gonna happen. It's not gonna happen. But weekly pay, you can make your own schedule. Now, for nursing or anybody in the healthcare field, working 8 to 5 is not a typical nursing schedule unless you're like in the educational part of it or management or administration. Me just working 8 to 5, I'm like, thank God I can work 8 to 5 because I have a kid. I gotta make sure he gets to school. I gotta make sure he gets home from school. That was my biggest concern, and that's why I cannot work 12-hour shifts. That's why I'm not in the hospital and all that other stuff. You can really cater your job around your life and not the other way around. That is super important to me. Like weekends off, y'all, weekends off. I don't have to work every other weekend. Y'all, it is such a stress relief. Y'all not understand, like, y'all, I'm not about to be finding my own coverage. Usually how home health works is they'll be like, hey, say it's April 1st. Hey, Kylia, do you have any days that you think you're gonna need off for this month? Give me a few days. Let me just check my calendar, see if I have anything planned. I'll get back with you. It's like that. And we all know sometimes some things come up, like you get a flat tire, you might run out of gas, your kid gets sick. When something like that happens, it's not the end of the world how it would be if you worked at a hospital or like a long-term care facility, because 9 times out of 10, the parents or the caregivers or the relatives, whoever, if you have a child or an adult client, they're gonna already know how to take care of their child. They've been doing it for X amount of years, most likely, okay? So it's not like you have to go and find coverage for your shift or be stressed out, like calling out at like an hour before your shift starts because you don't have coverage. Like, my son is sick, what can you do? That type of thing, okay? Also, you do work with other nurses. Like, in my case, I do have a nurse that works 8 to 8, and I know it's like 7 to 7 is like the standard for nursing, but home health, you can just make your own schedule. Like, me and the other nurse work hand in hand. Like, hey girl, I'm not gonna be there, just make sure you report to mom or dad. Like, it's the best decision I have ever made, for real. Also, what did I say? Weekly pay, you can make your own schedule. They do have insurance agencies, home health companies. I don't know why I've been hearing like they don't do insurance. They do insurance. You do have that option, like within your first 30 days. I think that's all my pros, for real. And if you're like me, like I'm a mom, I need to I need to make my own schedule because I have a kid. Like, he has other stuff going on. I need to have weekends off. I need to be paid weekly. It's just the stress relief of not having to go through Lakeisha, Shonda, Angie, Angela, and all these people to get a day off. Not having to call all these people to find coverage for an 8-hour shift. Not having to be on a point system every time you call out, because life happens. I think the biggest takeaway from going into home health would just be you can really build your work life around your life, if that makes sense. Now, there are some cons to it, don't get me wrong. For me, just in my experience with home health in general, not just with the company that I'm with today, so I only have one client, okay? I have one client. If this client goes to the hospital for any reason, for 1 day to 3 months, I am out of work until that client gets discharged. I do not go to any doctor's appointments with the client. Usually that's per the family, but most times you don't go. As soon as the client is in the hospital, your care is not really terminated, but it's on like a hiatus, okay? That's why if you're gonna work for a home health company, make sure you have at least 2 clients, and maybe a 3rd one just in case. You can just pop in, PRN, because if you can't get your 40 hours a week, at least try and get like 36, okay? 36, 30 hours, just wherever. Yes, you may have to travel. Luckily for me, I thank God, it was like meant to be. Luckily for me, I don't have to travel far at all. Like, my house and my client's house is like, it's not far. It's maybe like a 15-minute drive. Thank God for that. But if your client's in the hospital, you do not work. So that's why you have to have like a backup and a backup and a backup. Or you can have a backup PRN job altogether, which is also a smart move to make. Because home health is not, it's stable, don't get me wrong, it is stable for the most part, but you always have that chance, like, okay, my client's not looking too good, I can't do any more than what I'm already doing. This person will probably do a lot better in the hands of a hospital, okay? And as soon as EMS comes and gets your client, you are off the clock, give a report, and you go home. That is the only con I can think of. Oh, and some agencies don't have a 401k. My agency don't have a 401k. I'm a little salty about that. I should have read the fine print. I really should have. And with anything, just make sure you read the fine print. Okay, like really just make sure you read it. And also, another thing that I found out with home health is you can quit. Like, say, what's today? Wednesday? No, today's Thursday. Say if I want to quit my job tomorrow, I can be like, hey, Friday's gonna be my last day. You can say that, but as long as you pick up a shift, what is it, once every 6 weeks, you can still be active with that company. You probably won't have that same client by the time you come back though. So it's kind of like that. I hope I'm making sense. yeah, I think that's really all the cons that I can think of. So that'll be it for this video, you guys. If you like, comment, and subscribe. If I missed anything, or if you guys feel like you need to educate me on some things, just leave it in the comments. I would love to interact with you guys. Thank you so much for watching, and I'll see you guys in my next one.